What is drug abuse and addiction? Many people don't understand why or how other people become addicted to drugs. They may mistakenly think that those who use drugs lack moral principles or willpower, and that they could stop their drug use simply by choosing to. In reality, drug addiction is a complex disease, and quitting usually takes more than good intentions or a strong will. Drugs change the brain in ways that make quitting hard, even for those who want to. Fortunately, researchers know more than ever about how drugs affect the brain and have found treatments that can help people recover from drug addiction and lead productive lives. What is drug addiction? Addiction is a chronic disease characterized by drug seeking and use that is compulsive or difficult to control, despite harmful consequences. The initial decision to take drugs is voluntary for most people, but repeated drug use can lead to brain changes that challenge an addicted person's self-control and interfere with their ability to resist intense urges to take drugs. These brain changes can be persistent, which is why drug addiction is considered a relapsing disease. People in recovery from drug use disorders are at increased risk for returning to drug use even after years of not taking the drug. It's common for a person to relapse, but relapse doesn't mean that treatment doesn't work. As with other chronic health conditions, treatment should be ongoing and should be adjusted based on how the patient responds. Treatment plans need to be reviewed often and modified to fit the patient's changing needs. What happens to the brain when a person takes drugs? Most drugs affect the brain's reward circuit, causing euphoria as well as flooding it with a chemical messenger, dopamine. A properly functioning reward system motivates a person to repeat behaviors needed to thrive, such as eating and spending time with loved ones. Surges of dopamine in the reward circuit cause the reinforcement of pleasurable but unhealthy behaviors like taking drugs, leading people to repeat the behavior again and again. As a person continues to use drugs, the brain adapts by reducing the ability of cells in the reward circuit to respond to it. This reduces the high that the person feels compared to the high they felt when first taking the drug, an effect known as tolerance. They might take more of the drug to try and achieve the same high. These brain adaptations often lead to the person becoming less and less able to derive pleasure from other things they once enjoyed, like food, sex, or social activities. Long-term use also causes changes in other brain chemical systems and circuits as well, affecting functions that include 1. Learning. 2. Judgment. 3. Decision-making. 4. Stress. 5. Memory. 6. Behavior. Despite being aware of these harmful outcomes, many people who use drugs continue to take them, which is the nature of addiction. Points to remember. 1. Drug addiction is a chronic disease characterized by drug seeking and use that is compulsive or difficult to control, despite harmful consequences. 2. Brain changes that occur over time with drug use challenge an addicted person's self-control and interfere with their ability to resist intense urges to take drugs. 1. This is why drug addiction is also a relapsing disease. 1. Relapse is the return to drug use after an attempt to stop. Relapse indicates the need for more or different treatment. 1. Most drugs affect the brain's reward circuit by flooding it with a chemical messenger, dopamine. 1. Over time, the brain adjusts to the excess dopamine, which reduces the high that the person feels compared to the high they felt when first taking the drug, an effect known as tolerance. They might take more of the drug, trying to achieve the same dopamine high. 1. No single factor can predict whether a person will become addicted to drugs. A combination of genetic, environmental, and developmental factors influences risk for addiction. The more risk factors a person has, the greater the chance that taking drugs can lead to addiction. 1. Drug addiction is treatable and can be successfully managed. 1. More good news is that drug use and addiction are preventable. Teachers, parents, and healthcare providers have crucial roles in educating young people and preventing drug use and addiction. This video article is sponsored by Signal Health Group, Assisted Care at Home, and Signal Health Group franchise. If you're searching for personal care, home health, or hospice care, please reach out to us to discuss the costs and the coverage you may receive from your current health insurance providers. We would be happy to help you stay safe, healthy, and comfortable in your home for as long as possible. For those who are interested in business opportunities across the U.S., Signal Health Group is a franchise. With the number of older individuals growing every day, choosing to run a home care agency is a wise idea. Learn more about our services offered across the United States and business opportunities at signalhg.com or call franchise 800-953-6183.